Okay. Okay, so we will wait for more people, and let's wait another minute. Okay, so I will run the webinar in English because we don't have only Polish people here. We also have people from different countries. So, the webinar will be in English. But if you, for example, if Polish people want to understand something in more detail, then I will be happy to contact you by WhatsApp, or you can text me on social media if you want to understand something. Okay, so let's start the presentation. And one more question, if you can text me, if you can hear me well and see me well, and if everything is okay. So let's start. So today I will run the presentation about postgraduate aesthetic medicine studies done by Amir. Who am I? I'm a doctor from Poland, and I'm a coordinator of the Masters in Aesthetic Medicine, Nutrition and Anti-Aging. Okay, what is Amir? Amir is an international group specialized in postgraduate education and specialist training in the healthcare field at all academic levels. And to be more clear, this is a big organization, and they specialized in postgraduate studies for nurses, for physiotherapists, and also for doctors. And maybe it would be easier for you to understand for Polish people. In Spain, doctors need to pass MIR. This is something like LEC in Poland. And AMIR has a course for doctors that, for example, will prepare doctors to pass this MIR. So it's a really big organization. And what is important for us, they have a course about postgraduate studies for doctors, and they are with collaboration with a medical university from Łódź, and that's why they have the studies in aesthetic medicine. Who can enroll for the studies? This is a really frequently asked question. So you can enroll for the studies if you have a degree in medicine. Here I need to say that you can enroll for the studies during doing your internship. So I don't know if doctors from different countries has an internship, but in Poland, after 6 years of studies, of course, we need to do this internship, and during this, you can enroll for the studies. Students with a foreign degree are not required to have their degree approved or recognized in Spain. It is not necessary to have a specialty in medicine, so you don't need to be a specialist. You just need your diploma that you are a doctor. And also you need to have a good understanding of the English language. This is really important because I think 90% of the studies are in English, and also the practical part is only in English. Oh, and here one more thing, because also many people asked about it. Can dentists enroll for the studies? And unfortunately, dentists can't enroll because of the Spanish law. In Spain, dentists are not allowed to carry out the aesthetic medicine procedures. I think the same is in France, and we need to just respect the Spanish law, so that's why those studies are only for doctors. How long do the studies last? And they last 8 months from April till November, so they start at April. But the access to the platform is 9 months, so after finishing the studies, you will have also 1 extra month to read everything from the platform and to learn more. What is the study mode? So the study mode is hybrid mode. It means that they are divided in theoretical part and practical part. Theoretical part is fully online, so you can watch everything, every lecture from your computer. You can do it whenever you want, how many times you want, and you don't need to move to different city. You just turn on your computer and you can watch whatever you want. The practical part is in Madrid, in Aesthetic Medicine Center. It's really close to the city center, so it's nice that you can, after, for example, the studies, you can go to the city center by subway, and it's really close. Okay, let's go further. Theoretical classes. So there are 65 hours divided in 9 modules. They are recorded in high definition. They are available in the student area. The classes can be viewed as many times as the student wishes. They are dubbed and subtitled in English by native professionals, and there are PowerPoint slides and notes in English. What can I add here is all of the studies, the theoretical part, is on a special platform. This platform is specially designed for those studies. And I think 90% of the doctors are from Spain, so they speak Spanish. That's why all of the movies, the lectures are dubbed in English. And also you have the subtitles, so if you couldn't understand even the native English speaker, you can easily read everything. Also, what is important, you can, after every module, you can download 2 things. One is a presentation, and second thing is a script. And those scripts are in a really good quality. So even if you lose access to the platform, still you will have everything on the scripts. When is the deadline for signing in for the studies? It's about 2nd week of June. So they start in April, but you can enroll till the 2nd week of June. What is the language of these studies? So as I said, 90% is in English and 10% is in Polish. I actually got one question about it, so I will make it more clear. The whole platform is in English, everything is in English, but there is like additional unit, like 3 or 5 movies, lectures done by Polish doctor. And these additional lectures are in Polish. And what is also in Polish is that you can pass exams in Polish. So you can choose whether you want to pass them in English or in Polish, because you have 2 options on the platform. So this platform is suitable also for foreign people. This 10% in Polish it's just those additional movies are not so important to fully understand the studies. It's like a really small part of it. Okay, this is really frequently asked question. What kind of diploma will I get after the studies? So you will get a double certification, one from Universidad a Distancia de Madrid and one from Medical University of Łódź. And this is really important because people from Poland asked me if their diploma will be valuable in Poland, and it will be because you will get it from Medical University of Łódź. So whether you can practice aesthetic medicine in Spain or in Poland. How can I pass the studies? Okay, so the general structure of the studies is the theory, the modules from 1 till 9. You do it, then you can online test for each module. So you need to pass 60% of online tests and do 60% of theory. And then you can go for the international week and this practice workshop. After that, you need to write the thesis. Thesis should be for 24 pages, I guess, and you can choose the topic, whatever topic you want. If you want to write a thesis about polylactic acid, you can do it. If about hyaluronic acid, or I don't know, maybe lasers, you can choose whatever you want and write about it. And after that, you will get a grade for this thesis. And then when you will pass all the exams, you write your thesis, you will get the grade. And when you finish the international week, you can pass the studies. And then you will get your diploma. How many students are in the class group? In the class group will be 5 to 6 people, just to make it really convenient for you. And we think that this is the amount that one doctor can handle. So Amir cares about your actually your knowledge and your practical part. And thanks to those groups, you can do every procedure. This is really important. Okay, where will be the practical week? As I said, it will be in Madrid, in aesthetic medicine clinic. What techniques and procedures will you put into practice? This is just a short list. I will go through this in more detail in next slides, but you will put into practice lasers and other sources, PRP, peelings, body mesotherapy, tension threads, hyaluronic acid fillers, Botox techniques, and microneedling. Okay. What is the program of the studies? So this is divided to 9 modules, and I will just briefly go over this because you can read it by your own. It's everything is in the Amir program, and I think it's on the website. But what is important for me is that you will have module 1 as a general aspect of aesthetic medicine, and what is the most important here for me is the anesthesia, because in this module it was really good. It was really really nice done, because there were movies that showed actually how doctors do the anesthesia to the specific procedures. So it was quite nice for me. Module 2 is lasers and other light sources. So this module is divided to the treatment of specific lesions, and it's really done in detail. So you will learn about, I think, every laser and every light source here. Module 3, this is, I think, the most important module for doctors, because we do those kind of procedures most frequently. Here you will learn about facial anatomy, skin structure, also neurotoxin, botulinum toxin, and this is really nice done, because here is a botulinum toxin, the upper phase, the lower phase of label procedures. So everything that you need to know. Also different dilutions of different types of botulinum toxin. It was really, really good prepared. So second of all, it's bioplasty, implants, fillers, collagen stimulators, mesotherapy, micro needling, tension threads, PRP. Like, here is everything. Module 4 is hair aesthetics, trichology. Here you will learn about types of alopecia, about capillary mesotherapy, hair surgery, implants, and I need to mention that Amir also has different course focused on trichology and hair transplantation. So if you are interested, you can also check this one. Module 5 is body aesthetics, so all of the procedures but connected to the body. Module 6 is endocrinology and nutrition. So here, diets, nutrients in nutrition, endocrinology, all you need to know. Module 7 is global evaluation of the patient in aesthetic medicine. It's also important right nowadays, because here you will learn about plastic surgery. Of course, not about the plastic surgery, but about the procedures that can be done by a plastic surgeon, because sometimes we as aesthetic medicine doctors are not enough for some patients. So we need to know what kind of procedures can be done by plastic surgeons, so we could easily say our patients that they need to go somewhere else. Psychiatry, psychology, it's also really important, because sometimes patients need us, they need psychiatrist, just that. Okay, and the module 8, the aesthetic consulting room. So here is everything about marketing techniques, how to set up when practicing aesthetics, management of an aesthetic consulting room, management of social media, how to create your personal brand. It's also important nowadays. Module 9 is other aspects in aesthetic medicine, so ultrasound in aesthetic medicine. This is something that really developed during like past 1 year, and I'm glad that I could learn about it in Amir, because it will be more and more popular. Aesthetics on the oncology patient, really very important, because many oncology patients right now do care about their look. So you need to know when to treat this patient, or maybe you can't do it. So you need to know when should you treat them. And the future of aesthetic medicine. Module 10 is master's thesis. So as I told you, this 24 pages that you need to write by your own, and then intensive practical week in Madrid. Okay, practical week. So something that is, I think, the most important for you. Here, you have a sample of the workshops. This is actually, I'm sorry. This is actually a program of mine practical week. Your will be different, because it was just changed. But I will go briefly over mine. because yours will be, I think, more or less the same or familiar. So on the first day, we had welcome session, beauty assessment, Botox design, so just a little bit of everything. But we were practicing on the first day on real models. So we had real patients, and everyone from our group could carry out some kind of procedure. On the second day, it was facial PRP, hair PRP, nanosoft. This is also important because those needles are quite often used. So good that they were in practical week. Dermapen, tension threads. And for the day, we had carboxytherapy, laser, peelings, body mesotherapy, facial mesotherapy. Fourth day was full of fillers. So we did many procedures with hyaluronic acid filler. We did under eye filler, cheekbones, chin, lips, body, and also nose. Okay, so fifth day it was about Botox. So we did procedures with botulinum toxin. We were learning how to dilute different toxins and how many doses should you use doing the procedures. There was also hydroxyapatite. There was polylactic acid, and also we had other techniques like peelings and so on. It looked like that we were a big group. We spent the whole day doing those procedures. We could also carry out the procedures on our own. So sometimes if someone from the group wanted the procedure, we could practice on this person. It wasn't like we didn't have models, just sometimes some of us wanted to have something done. It wasn't a problem. And after the lectures, we used to go somewhere to visit the Madrid and so on. Okay. And about my personal experience, I think those studies were really important for me. I wanted to have the studies not in Poland, so I was looking for something from abroad, and lucky me, I came across the Amir studies, and for my big surprise, they had a collaboration with Medical University in Łódź. So this is a really win-win situation because you get 2 diplomas. You can practice in Spain or in Poland. Also, I got to know so many really nice people there. Actually, with 2 of them, we are going to Aesthetic Medicine Congress in 2 weeks' time to Bologna. So those contacts, those people were so good and so nice and likely-minded that they are with me right now. It's also nice that you have 7 days in a row, so you spend so much time with the same people, and this was quite nice because you can really focus on the practice. Also about the doctors, they were really advanced, and they were helpful. They were also patient, and they explained everything to us. So I think I can recommend it. It also depends what do you expect from the studies. I wanted to have studies online because I didn't have time for driving to different city to have the postgraduate studies. And here, all of the theory you have online. And right now, Q&A. So if you have any questions, feel free to ask. Maybe you have some questions. Okay. Let's see. I can see one question. Okay. Since I will have a diploma and certification in Spain, will I be able to immediately perform treatments in Spain as an aesthetic medicine doctor after obtaining the AMIR title? I'm a doctor from Poland. If not, will the bureaucracy in Spain be simplified than without this diploma? Still, if you are a doctor from Poland, you need to do a reconocimiento. So it means that you need to have diploma that you are a doctor in Spain. So you need to do specific type of bureaucracy, but in Poland, you need to send your certifications, that everything that you are a doctor, to a Ministerio Saludad. So it's a department of healthcare in Spain, and you need to get the same qualifications. And after that, you, with the AMIR diploma, you can immediately practice aesthetic medicine in Spain. But it's important that in Spain you need to have a diploma as a doctor. This is the most important. They really care about it, and in Spain only doctors can do aesthetic medicine procedures. Okay. And is it gonna be simplified? I can't understand if simplified. It won't be simplified. You just need to be a doctor, and when you get this AMIR diploma, it will be more easy to get a job here. But still, you need to be a doctor. Okay, next question. What if I pass all the theoretical exams but won't be able to participate in practical part due to, for example, breaking a leg or falling ill? Last year, I guess we didn't have such situation, but it was said that there will be two different dates of practical part. So I will ask about it and answer it on private for you. But I think that you can choose from two different dates. Okay. Can we practice anywhere in Europe or only Spain? Wait, or only Spain and Poland? During what months is the International Week? About how many patients will each student get for each procedure? Can we practice anywhere in Europe? This is not a question for me, I guess, because you need to get to know what kind of diploma is valuable in your country. Okay, wait. Sorry, I just read the answer for one question from AMIR group. So I don't know if this diploma is valuable in different countries. You need to check it. I know that in Poland is, and that in Spain is. During what month is the International Week? Last year, it was in October. What about how many patients will students get? Oh my God, it's a hard question. Yeah, this year is November, so it will be in November. Okay, about how many patients will each student get? It's a hard question because it looked like that we had the model for one procedure, and everyone from our group could do something about this procedure. So, for example, we had a cheek fillers, so everyone could do some kind of some part of this procedure, but we, for example, had like 2 or 3 models for the same thing, or 2 or 3 models for lips fillers. So I felt like I really could practice something. Of course, I won't lie, aesthetic medicine school is not the same as a course. So when you go I also went to many courses in Poland because I think that the school is just a school and it should give you a brief on everything. And if you really want to learn how to do beautiful lips, you need to go for a one-to-one course with someone that you admire, that you like the work he or she is doing. So this is my answer for this question. Okay. Do postgraduate studies alone provide enough practical training to start seeing patients in? Oh, this was actually, I think I answered this, but I will do it one more time. So I think you can start, after the studies, you can start seeing patients independently, but I think if you really want to be good, you need to attend also additional courses, and it's no difference if you do a Polish school or different school. You just need to practice more if you really want to be good at it. But if you want to be independent, I think it's enough. Okay, how long does it take to receive the diploma? Because of the Spanish bureaucracy, not AMIR, but the specific organization that gives doctors those diplomas, it can last 6 months to 8 months, or even sometimes longer. But we really don't know because of this organization that is not connected to AMIR. I have a question regarding certificate. How long after finishing the whole course will I be able to receive certificate? And will they be sent to us by email, since some of us probably live in Poland? How long after finishing the whole course will I be able to receive certificate? I think this is the same question. So 6 months to 8 months to maybe 1 year. It depends. But you will get something like an AMIR certification that you passed those studies. You just won't get this diploma from this organization. And how will they send it? I just need to ask my AMIR support about how will they send it. Okay. And I will answer it by email. Okay, it will be by email, and this will be valuable. Okay, I will expand on my question. So I don't have to take the MIR exam, but I have to send documents to the health office in Madrid confirming that I'm a doctor from Poland. I have been practicing for 12 years as a doctor in Poland, of course, with full license to practice the profession. Yes, it's like that. You don't need to take MIR. You need to have MIR if you would like to get to the specialist training. So if you would like to become a specialist in Spain, then you need to pass MIR. But if you want to practice aesthetic medicine in Spain, you just need to have this reconocimiento. So only this, and also the diploma from AMIR, for example. You can have it from a different organization, just something that confirms that you can practice aesthetic medicine in Spain. It's not important how many years were you practicing in Poland, because anything is not valuable until you don't have this confirmation that you are a doctor with the whole right to practice being a doctor in Spain. Okay. What kind of body treatments will be performed during the practical part? As you can see, I would need to go for. Okay, so as I remember, we did polylactic acid on Botox. We did also body mesotherapy. We did fillers. We did carboxytherapy. What else there? I can't remember actually, but I think you can see if everything is wrote on the program. So as soon as you get the program, that will be on this edition of the studies, then you will get to know what kind of body treatments will be carried out. Regarding the certificates, so 6 months to 1 year, but what a certificate from Polish Łódź University? Will it take 1 year as well to receive? I think they are connected. So I will ask about it and I will write it to you in a private message because I'm not sure about it. Okay. And so the reconocimiento is just a legalization of the Polish medical degree. Do we need to have done the leg? Oh, reconocimiento is something that can do everyone from European Union. So there is something like that every doctor from every country from European Union can get the diploma that he or she is a doctor, and that their diploma is also valuable in different countries. Just you need to check how to do it in your country to get this reconocimiento. This is just the Spanish word, but I know how to do it in Poland. I don't know how to do it when you are from Germany or from a different country. So you need to ask your organization, for example, your healthcare organization. I think someone from there will know. And regarding the earlier conversation from different questions, does that mean we as students will not be able to perform one-to-one on all the procedures? One-to-one, it means like one doctor, one student, or one student and one model, because the one doctor is for the whole group. Whole group contains of 5 to 6 people. So you won't have your own doctor, but if you meant the one-to-one, like one student and one model, I think you can just for example, ask people from your group that you would like to do this specific procedure by your own, and I think they will be like, okay, because we sometimes did it. So, for example, I had experience in doing polylactic acid, so I allowed my colleagues to do it, and I wasn't doing it because I knew it. And for example, I didn't know how to do a nose filler, so someone said, okay, so you can do it by your own. It's just a matter of agreement in your group. Do I need Spanish language certificate to receive reconocimiento? No, you don't need to have a Spanish language certificate. It's because of this European Union directive, and there is said that all of the diplomas from European Union are valuable in Spain, and you don't need to have the specific certificate that you know the language. What is the best way to start working as an aesthetic medicine doctor in Poland? Setting up own practice, how to find first job. Oh my God, this is a topic for another webinar, but I can try to answer this. What's the best way to start working? So I think you need to first of all do many courses and have this confirmation that you made them. then you need to find a job, and you can look for the job, for example, looking on OLX or Facebook, or sometimes just go to certain clinic and ask if they don't need a doctor. But the most thing that is important is that you have a practice. So you have this certificates, or you have, for example, the certificate that you have finished the aesthetic medicine school. And how to find the first job, as I told you, you just need to go somewhere and ask someone and show that you are an independent doctor and you can do all of the procedures. Sometimes there are places where they will have this agreement with you that you don't know everything, but you will get paid like less than you should be, but you can learn from the older doctors that work in this specific clinic. Is the LEK necessary? No, LEK is also not necessary. It's necessary in Poland, only in Poland, to have a certificate that you are the diploma that you are a doctor. So this is only a Polish thing. Sorry, quick question. Can you quickly share with us how to have this reconocimiento for Polish graduates? How to have, for Polish graduates? I don't understand the question. How to have this reconocimiento for Polish graduates? Meaning in Poland. But from what country are you? Because this is something that we in Poland do to have a diploma in Spain. And how to do it, I can share it with you, but on a WhatsApp or private conversation, because this is like this document, and I wrote it. It has 3 pages, so it's not so easy to explain it. I can share it with you in private. Okay. Do we have more questions? I don't think so. Maybe one more? No. Oh, can you share it with me? Yes, of course, I can share it with all of you. Okay, so I think we are done. No more questions. It was really nice to meet you, and I hope that I answered to all of your questions. If there is something, okay, if there is something that you will need to know, then feel free to ask someone from Amir, or on WhatsApp, or text me directly. So thank you. Bye.